fall prevention in the hospital. How do we prevent falls? And who is at risk? And what do we do if somebody falls after falling in the hospital? So the people who are at risk are people who are most likely elderly, somebody who just had a surgery, somebody who has have problem with immobilization, like broken leg or neurological problems, not feeling one of their legs and so on. Another area of patients who are at risk are people who do not hear well or who have vision impairments. Patients who are agitated, confused, they also are at risk for falls. How do we provide safe environment? We keep room, hospital room, empty from all clutter. Make sure there are no electrical wires in the room, on the floor. Make sure at least one of the side rails is down so patient can get out if they need to, or at least they feel like they are not locked in the bed. Especially that's important for confused patients. They need to feel like they have freedom of movement. Another area what prevents hospital falls is to keep call bell at reach and make sure we teach patients how to use the call bell in the hospital. And also leave appropriate light in the hospital, even at night. Leave enough light for the patient. Another areas of safe environment is to promote walking if patient is able, and to make sure we get patients out of bed on regular routines. So they should be toileted before and after meals. They should be walking at least twice a day with physiotherapists who should assess them for appropriate walking devices like wheelchairs, canes, and walkers. Another area to remember is to always keep personal belongings close to the patient. If they are in bed, for example, and they need to reach for water, comb, toothbrush, they will be most likely at risk for fall if they cannot reach the items. Make sure you always ask them before you leave the room, is there anything I can do for you? Do you need a drink? Do you need to go to the bathroom? Are you hungry? Also provide foot care and proper shoes when they are walking. Make sure those shoes are non-slip shoes and make sure they well fitted for the patient. Not too tight, not too loose. Communicate with family. Have meeting regularly with the family and the patient and develop a care plan where you will decide how often patient should get up, what exercises should patient do, and what kind of medication is the patient on, and what are the risks for falls for this patient. And again, remember to alternate environment. Assess the environment for fall of risk. Assess the patient. Are there any stairs? Is the patient able to walk up and down the stairs? Provide railings and provide safety bars, especially in the bathroom. Make sure there are safety bars or raised toilet seats that patient can use when he is going to the bathroom. And lastly, what should nurse do if patient falls? If the patient is on the floor and the nurse has found them on the floor, nurse should assess immediately if there is head or neck injury. If there is no apparent injury, leave the patient where they are and assess the patient. However, provide comfort with pillows and somebody who will stay with the patient and reassure them that help is coming. After you have assessed the patient, taken blood pressure and assessed them for any injuries, use the mechanical lift to lift the patient back to bed. If there is injury that you are suspecting, make sure you do not move the head or neck and call paramedics. After you have called paramedics, ensure there is somebody with the patient that stays with them all the time and reassure them. Make sure that the head and neck are immobilized, and also remember to reassure patient while you are assessing patient. After the injury, make sure you document everything appropriately in nurse's notes. And lastly, remember, everybody is at risk for falls, and it's everybody's responsibility to make sure we have reduction of falls.